Our primary healthcare system, which it actually should be our savior because it's very big on preventive healthcare, doesn't exist.
Sir Ikechukwu Anoke is the founder and CEO of Zuri Health, a virtual hospital providing quality, affordable, and accessible healthcare to patients across Sub-Saharan Africa. He's also an author of the book I Am Ikechukwu, an autobiography detailing his entrepreneurial journey. Welcome to the Noble Conversations platform. In case you've forgotten, which I hope you've not, we're a platform that aims to build this Nigeria and society of our dreams. By doing what? By engaging in noble conversations with those who are making community and global impact. Today we'll be having a noble conversation with Ikechukwu Anoke on his journey from waiting tables at his mom's restaurant at age 10 in Enugu to success in the entertainment industry and success as an entrepreneur through Zuri Health. So the book is called I Am Ikechukwu. Let me ask, who is Ikechukwu? When you think of him, who is he?
Well, the book is I Am Ikechukwu, The Vision Will Not Tarry. Ikechukwu is just a regular guy trying to fit in a regular world who have, been through a lot, but also feels that his story is important for tomorrow. And that's who Ikechukwu is. Ikechukwu is 40, a loving father of 2 girls, a husband to an amazing superhero, an entrepreneur, someone who loves God, and someone who believes that I am here for a purpose. And one of my visions, or one of my mission is to be in the marketplace, do amazing things, and when people see those incredible, amazing things, they would say, I want to serve the God he serves. One of the very important things about, kingdom entrepreneurs or people who believers who do business is that over time we're very shy, if I may use the word, to come out and profess our faith.
Why? Why is that?
I don't know. A lot of people are. I'm not. A lot of people. You don't look around and see a lot of believers who come out and say, "Hey, I am doing this incredible thing. I'm a believer." But you see a lot of role models, business people who have flashy lifestyle, who want to enjoy, fly private jets and whatever, and people and party and do a whole bunch of awesome things that they like to do, and people look at that lifestyle. I hardly see.
So do you think it's because like they see, okay, I've been this successful so far. If I talk about God or if I share the fact that I'm a believer, then that could affect the way people view me and then affect the way people consume whatever I'm selling, whether it's a product or whether it's entertainment. Do you think that plays a role in it?
No, I think it's people who don't understand who God is that will think that way.
Okay.
Because my experience has been different. The more I talk about how God supports me and how that at the foundation of what I'm building is God, the more I am solid in what I do. And that's what God wants us to do. God wants us to be in the marketplace and glorify him and say we worship God. And if anybody says I'm not going to be I'm not going to support what you do because you worship God. And I don't want your support. I'm sorry about
Yeah.
that. It's not, I make no mistakes or pretenses about who I am. I make no mistakes or pretenses about this, who God is for me. My covenant verse and the covenant verse of my business is Habakkuk 2:2-3. It's on the wall in my office. It's not, I don't hide about it. It's not something I want to, you know, be afraid to say that the God factor is center to what I am building at Zuri Health
Hmm.
and center in my life. So why do I want to talk about something else that is not there? Yeah. Not.
Mm. Okay. So how did you develop that perspective? Because some people, maybe there was a specific event that happened where they were like, okay, I'm building whatever I'm building has to be for God. While some people, it wasn't really. It was just kind of okay over time. But how did you
Mine
develop that
mine was over
perspective?
time. Mine was over time. Mine, I went through different things, went through a crisis. And I'm not going to preempt you since you bought the book, you might want to read it. Um the the thing is that building Zuri Health is not just my dream. It is not just a father's promise to a daughter, because Zuri Health is named after my daughter. It
Yeah, I
is
saw that.
God's mandate for me, right? It is God saying, I'm going to gift you this for you to use it to impact lives of millions of people who need access to affordable healthcare. And I'm going to make it special. I am going to give you favor. I'm going to open doors for you. And all these things
Hmm.
are happening because God wants me to use it to transform lives. And that is it. That is it. There's a God factor and a massive, huge cloud of God factor in what we do at Zuri Health.
So Ikechukwu is a loving husband and father and a believer in God who is using Zuri Health to transform lives. And so when people see what you're doing, they could say, "Oh, I want to serve the God that he's serving." Is that accurate?
Yes, that's very accurate.
Okay, so when you decide, when did you decide to write this book, and what inspired you to say, "Okay, I want to write a book," and what do you hope it achieves as well?
Um, I was going to turn 40. I turned 40. And so in the preparation of me turning 40, I wanted to put together my autobiography.
Mm,
I figured that it was important that I told my story. Um, and it was very important that I did that. So that's one. Number two is I also felt that, a lot of things have happened. I've lived a lot of lives. And that perhaps my story could influence someone. My story could motivate someone, inspire someone, and it was important to document. And I think leaders, business leaders, African leaders, um, people generally should learn to document, right? Document. I loved reading Obama's Dreams of My Father. And I figured that I should take more time to document about what I was going through. So yeah.
did you read The Promised Land as well?
No, I haven't read that. I intend to
Not
read
that.
it.
Okay, I started it. It's long. It's long. I think I'm almost halfway through. Um, so okay, you talked about telling your story to inspire people. Part of your story, as I saw in the book, is that you started out waiting tables at your mom's restaurant in Enugu. Um, how old were you when you started out?
was 10.
10. Okay. Okay. And so how did that experience shape your approach to entrepreneurship and to life in general?
I think that was my entry into entrepreneurship. I think my entry into entrepreneurship was Owerri Road. Owerri Road was where my mom's restaurant was.
Mm,
And the experience of Owerri Road was my entry into entrepreneurship. But I was solving a problem. So I I'm one of those who believe that entrepreneurship stems from a desire to fix a problem. It could be a small problem, it could be a massive
mm-hmm,
problem. But at the core of entrepreneurship is problem solving. There's a need that they're trying to fix. So need I was going to fix was just generally we needed to earn more. There was hunger.
mm-hmm.
There was hunger.
Yeah.
And we needed to earn more. I felt my mom was overwhelmed. I felt my father wasn't in the space to do that. And as the first child, I figured it was my responsibility to step in. And that was it. You know, I took I got bitten by the entrepreneurship bug at 10 and they never left 30 years later.
Mm, mm. And so it was you felt a sense of responsibility.
Yes.
Okay. Okay. And um, in terms of the entrepreneurship ventures that you've explored, one of them is Playgroup, in the entertainment business. Um, what inspired you, or what prompted you to get into the entertainment business with record label and live events and other aspects of Playgroup?
Well, I would say that it started from me coming to Kenya. Actually, I would say even before coming to Kenya, I was social prefect in Federal Government College, Port Harcourt. In Federal Government College, Port Harcourt, I used to organize, social nights, and I would
Mm,
invite, people from FGGC Abuloma, different other schools to come through,
yeah.
and we will not just do that. We will set up what we called it was like a social night. We will set up, gate fees, have people charge gate fees to come in. So I was sort of doing events even when I was 15. Got into university, joined the band called Solidad. We were performing
Mm.
Westlife songs and then Namdi Azikiwe University Oka. And they used to pay us to come and perform for different nights.
Wait, were you singing?
We're just miming, we're not singing. Just coming
Oh,
to perform
okay.
for different nights, mass communication night, um, whatever science nights. And it was just us
Do you have any
forming.
videos from when you were miming?
No, but I think there's some pictures here and there. Soledad is a keeping for the lonely.
I think, yeah, I think I want to see some of those pictures if they're online or somewhere.
so, so we used to mime and perform Soledad. So we're this boy group, Westlife. And
Yeah.
Westlife was the raving thing at that point. So we used to do Westlife. So after that, I joined. Um, you know, when I joined MTech, came to MTech being a sort of entertainment company, but focused on tech, selling content, entertainment content to telcos. Selling that, putting that up on telcos, um, and people were, buying the content, So when I came to Kenya, I faced a huge challenge. And the challenge I faced was, you know, lack of acceptance. Being a Nigerian was very difficult. There was a lot of stereotypes, and
Mm.
music broke the barrier. We used music. I used music to break the barrier. Because of what I did, Nigerian music took over Eastern, Southern part of Africa in terms of promotions.
Mm-hmm.
So I was doing it to generate revenue for MTech because we're selling color ringtones and ringtones. I was doing it to, so from there I said, you know what, I can do this.
I remember when you used to have ringtones. Yeah, yeah.
And I said, you know what, I could also do events. And I started bringing the artists, doing events. And that's how I got into events. And I said, if I could make music popular, I could as well do a record label. And I did a record label at that point, and it was very successful. At the point, it was successful. And yeah, until I decided to focus on doing something else.
Did you ever consider uh performing, as in like making actual, whether it's music or what, miming, whatever, like professional? Like, did you ever consider doing that professionally, or was it just a thing that you did in college for fun?
It was the thing I did in university for fun. I never considered it. Although I have one rap that is for my kids.
Ah,
My name is Ike.
okay,
I'm the real G. Keeping it real, like a slap to
okay,
the face. You know my pedigree on the real. And that is for my kids. But
yeah.
when they diss me. So I have my second daughter Zara has a stage name which I'm never going to disclose because she will arrest me. And she uses that stage name to, write these songs for me. So
Wait, this song's like she's dissing you.
yeah, these songs for that. So and Zuri is her producer and hype girl. So Zuri will, set it up, hype girl and producer, and Sarah will be on the mic dissing me.
Ah, this is serious. This is serious. Serious beef, back and forth. Uh no, no, that's funny. So when you think about the entertainment business, right? What's the most difficult thing? I know you talked about stereotypes when you first moved to Kenya, and then music breaking that barrier. Um, in the entertainment business itself, what would you say is the biggest challenge you faced from your perspective?
Oh, I'm not that rugged to do music. I'm not a great manager. I don't know. I don't have the patience to manage talent. I don't have the patience at all. That talents are the most difficult, people to manage. I don't have the patience to do that. I don't understand. I don't understand a lot of things. So um the other challenge was that I didn't have the money to do music. If I had the money with what I know about music, even with the little I had, I was the most successful music label in Kenya, in Zambia, in Uganda at some point. Uh,
Mm,
if I had money in it, then I would have probably been the biggest record label on the continent.
mm.
Um, but so I didn't have the funding for it and the time. Also, the lifestyle around it, later on became a challenge for me because of that is not who I am, what I wanted to do.
Hmm.
So these were the challenges that I can say.
So what made you? I mean, being that huge in Kenya, what made you that successful, even with the fact that even the funding was not as available as you would have hoped it would be?
I s- I studied music very well. I studied promotions. I figured out the layers in terms of monetization. I could understand monetization from multiple angles. I could understand monetization from synchronization. I understood monetization from, digital element. Remember, my background is digital, selling coloring battles and selling ringtones. I knew how to make music popular. I understood it from the product development process, which means there was an art to the music released. I didn't release any music that did not have three legs to it, which is a synchronization leg, which is good for movie or good for an ad. I didn't have music.
No, what's the synchronization leg?
Synchronization leg is I would license a Netflix the music to use for a movie, or I would license a Coca-Cola the music to use for an ad. That was
Mm-hmm.
synchronization, and I had a sync leg to it, so I could do sync. Um, I also had, which was very important, um, which is very, 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 very important. So apart from the synchronization and digital content leg, it must be pop. It must be what the streets wanted to listen to. So
Mm-hmm.
yeah, and uh, for every so if I had these three legs done, I also had the network to plug it. I knew which radio stations to make the music power play on. I knew what DJs to send the music to and the influence the DJs and the radio stations will have in terms of crystallizing a huge hit. So I studied it to a science. I knew what to do. It was very clear, right? Every artist I blew from Nigeria, it was the same template, right? So I could make anybody
Mm-hmm.
big. I could literally anyone, any genre, from Omaomi doing to flavor to bracket. Bracket was so
Bracket.
big in
Yeah.
Eastern Central Africa that they weren't even known in Lagos, right? They were
Hmm.
so massive that they weren't even known in Lagos. People were wondering. I remember the bunch calling me to say, "Who are these guys? How come they are? I'm in Kenya and everybody's talking about Yuri and Yuri. I really don't know these guys that much. How did you do it,
I'm with you, my Yuri
right?"
Yuri.
So we knew what it
Yeah.
is. We knew what we could do. We knew what so to a science, it was a template that I had done. I could do it any day, anytime. So I could plug music.
It sounds like you studied it with like very down to the details, down to the specifics. Um, and I think of, you know, like other endeavors, it's the same approach that it takes to be successful, right? Like breaking things down to the science and saying, okay, what do I need to know to make progress in this specific area? I remember in secondary school, I played soccer, football, on the school team, and I wasn't the best. In fact, I shouldn't have even made the starting 11. Um, but every day I'll be watching videos, practicing. Okay, like because I played defense. So I'll be watching videos, practicing daily, 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 daily. And eventually I made the team, but I never considered myself the best player. But it sounds like for you, you saw this as an opportunity to, okay, let me learn as much as I can about this so I can make the most impact and study it and study it and study it. And it sounds like you're doing the same thing at Zuri Health too. Um, so how did you go from entertainment to providing health services, that are affordable and accessible through Zuri Health in Sub-Saharan Africa?
Well, that is my next book. Um, I've already started plotting it in my head. But so it's not just that studying is one thing. Um,
Mm-hmm.
but there's another thing that is extremely important, which is grit and determination. Even if I don't do much
Exactly.
in a particular field, if you called me now and I saw that I want to get into, you know, I want to get into snail farming. I wouldn't be surprised that in 2 years, I will probably be one of the well-known snail farmers. And it's not because I would go and study snail farming and learn all the things around snail farming. It's because in everything I decide to do, I give it the best. I am selfless and determined in everything I decide to do. So one thing that does for anything is that it leads you towards a path of excel in everything that when you sow that seed of determination, that seed of grace, then most likely you're going to succeed. And I
How do
always
you how do you
my strategy
decide? Oh,
my strategy is to build from a point of failure, which is I assume
okay.
that everybody has failed at this, and this is why they failed, and begin to solve problems around failure, which also means that I anticipate failure. I could say when I'm building, I plan scenarios in my head to say this could happen. When I was doing Zuri Health, I asked myself, what if the government woke up one day and said that there will not be any telemedicine? Everybody, if you want to see a doctor, go to the hospital. If I had a business that did only telemedicine, that business will collapse, right? So I need to build around that, right? I need to figure out how to build around that all the time. How do I recruit customers? Do I have the marketing budget to come and be doing ads to be able to get customers? How do I do that? So it's very instructive that when you look at how Zuri Health structures itself, the partnerships that we build partnerships with people who have trust equity, a lot of trust equity, that when they speak and say, do this, you do it not because Zuri Health is tied to it, but because the brand is tied to it. And by the time we associate with those brands over and over again, it makes more sense because you now begin to view us as credible. Because we do not have the money to buy the credibility or invest in building the goodwill and credibility they would have had at that time. So these are part of the things, that how we build, or how I see myself building.
So when you explore anything that you're trying to do, you start from the point of failure and say, okay, what could go wrong and what has gone wrong in the past for people that are doing this, and then build from there to basically ensure whatever you're doing against future failure in those ways.
Yeah.
Now, when you talked about whatever you decide to do, you do it well. That's a scripture in the Bible where it says, in whatever you're doing, do it as if you're doing it unto the Lord, right? How do you decide? Because you can't do everything well, and I feel like, especially in today's society, there's so much to choose from in terms of potential career options, potential, things to explore. But for you, how do you choose what to focus on and say, I am going to do this and I'm going to do this well?
Um, hmm. It's you know, you can look at it from a couple of angles. Um, I always see, sit down and act, it must be something I'm passionate about.
Hmm.
It must be something that I see a gap in. And a gap does not mean that a lot of people are not doing it, right? A gap could mean that I have seen that they are doing it, but if I did it this way, I could do better. It must be something I am extremely passionate about. I need to have it's something I like. And finally, it must have impact. I'm somebody who is very keen on solving problems. There are a lot of things to do that might not really solve much problems, but I would like to, focus on something that could, potentially solve problems for a lot of people.
Okay. So it's a combination of passion, where there's a gap, and where you can make the most impact in terms of problem solving.
Thank you very much.
Okay. Okay. So Zuri Health, um, when you look at the state of healthcare, in Nigeria and across the African continent, um, like it doesn't seem like, especially when it comes to like primary care services, it doesn't seem like it's as robust as it could be. From your perspective, what is the state of healthcare and healthcare services on the African continent as a whole?
Um, Two things. Africa healthcare in Africa is broken. It's broken, and it is also a symptom of our poverty.
Hmm.
And
How so?
you know, 50% of the population of the continent lives on less than $1 a day. We are very poor, and even without corruption, if you removed corruption and said all the governments in Africa, all the resources that you've generated without corruption invested in healthcare, we're so far behind that it would amount to a lot. It would help, but it wouldn't amount to a lot. So, from a skill set perspective, we don't have the skill set, right? We don't have, you know, the specialists for some very serious ailments. We don't have them. They don't exist on the continent, right? We don't have the money into research, drug discovery. We don't have any of those. We don't even have equipment in the hospitals. We don't have infrastructure. Okay. So these are challenges. Then there is a lack of education, basic education around health for people. So
Hmm.
our primary healthcare system, which it actually should be our savior because it's very big on preventive healthcare, doesn't exist. There are local governments in Nigeria where there's no functional hospital. And when you
Hmm.
walked into the nearest hospital, it is so broken that you being there, you fall sick. If you're not sick and you spend 1 hour in the hospital, you come out with something. These are the challenges, right? The cost of
Hmm.
healthcare is another big thing because we don't have access to insurance. The actual cost of healthcare is very expensive, right? So how do you tell somebody who earns 1,000 shillings, 30,000 shillings a month as a salary with 3 kids to pay for doctor consultation of 5,000 naira? How can they afford that and afford to feed and afford to pay rent and afford transportation? Sometimes the cost of transportation from your home to the nearest healthcare center, you can't afford it. So it's broken. It's completely broken. Almost maybe 98% of households in Africa are one major chronic condition from bankruptcy. If one family gets a case of cancer, it's done. They will sell everything. They are straight into poverty, right? If somebody had to be
Hmm.
hospitalized for 3 months, it's done. And that's the challenge. The insurance, cost of insurance, they can't afford to pay. Even when they can afford to pay, is a struggle to combine, should I pay for food? Should I pay for roof on my head? Or should I pay for health insurance? And even when they do pay and get the government insurance, it doesn't cover for much because there's absolutely very little things that you can find in a government hospital. Our situation is dire. Our situation is dire. And this is what we are building around to saying, how can we leverage? smart and non-smart solutions to ensure that people get access to healthcare. The most basic access. So if Noble has to sit in his room with his phone, whether smart or non-smart, and for 30 naira be able to get first level medical information, consultation from a doctor, then it's easier for Noble. And that is what we're trying to do. How can we create opportunities leveraging technology but innovative financial solutions for people to access healthcare from a mass scale perspective, especially from preventive healthcare? And when we see that physical, that digital might not, it's great, but falls a gap, we decide to combine it with our mobile clinic solution, which is Zuri Health is investing in mobile clinics, which is a hospital on wheels. Call it like a level 2 hospital, dental, optical labs,
Yeah.
x-ray, to have these mobile clinics be available to go around local governments, underserved communities to provide access to healthcare. Because I was in New York and in the Harlem areas, I saw a smaller version of our mobile clinics parked in the streets of New York. And people were going there to get basic things of cuts, bruises, vaccinations, basic things done for them and those. And I was thinking about it, and I was like, in this an area where there are hospitals everywhere. Okay, so and specialists. In fact, one of them was parked very close to Mount Sinai. And I kept asking myself, I'm asking myself, in my village in Uburo Hozar, apart from the Joint Presbyterian Hospital, that I hear there's been no power, electricity in that hospital for going to 2 years, and that most people don't have doctors or nurses. People have to travel 2.5 hours or 3 hours to Abakaliki to be able to see a doctor. Why? Why? So my uncle in Chiriagwe who's unwell, they are waiting for when he can be stronger enough so that they can put him in a bus to take him 2.5 hours to the general hospital in Abakaliki, and also plan for who will go with him, because it's likely that before they will see him there, it will be 3 days. That is broken healthcare. There's nothing more broken than that. And we're not in a war zone in my village. So think of that woman in Zamfara. Think of that woman in Borno State. Think of that woman in Kebbi. Think of them. Think of people in communities or states in Nigeria that don't have 10 doctors. Think of them. Think of how broken and dire our situation is.
And you mentioned take away corruption, right? Even if we were to invest in those systems, we are so far behind
We are.
that. So, like, what is it? Because I mean, is people can easily look at that and say, "Oh, it's corruption. It's because government is not doing this, government is not doing that."
If you
And
took
someone,
all the money, you will have to build rules. Because Dr. Noble will not go and stay in Zamfara where there is no road or electricity. Dr. Noble will decide to become a blogger, a doctor blogger in Lagos, than go to Zamfara. It's the realities that even that there are doctors who are in Lagos who are unemployed. There are unemployed doctors in Abuja. There might even be an unemployed doctor in Enugu. But they will not go to Uburo Hozara where there is no infrastructure, where there is no power, where there is no water, where there are no roads, where there's no, you won't go there. Where would you live? So you ask yourself, should I go there? Now, when you combine that, and in some cases, insecurity, right? Insecurity. If you're a parent today and there was the only area where there was opportunity, a doctor, your daughter, you say, I'm sending my daughter to Borno State to go and serve or to go and become a doctor in the whatever. How? Or I'm sending them to Zamfara where there are issues. Now add kidnapping. It's hard because all the things that you need to build, infrastructure, when you look at developed countries, everything is built in. There's power, there's water, there are roads, there are systems. You fall sick, you call an ambulance picks you up, takes you to the hospital, and maybe there are a lot of wait times, right? You see a GP and they'll say maybe an X-ray will take you 3 weeks to get an X-ray. But if your situation is very bad, then there could be there is some sort of some I would say some sort of system.
Structure.
We don't have any. We don't have any. To even make
And so
matters
if we were
worse,
to
a large percentage of the medication we consume is fake. So where do you want to begin from? Where do you want to begin from?
what percentage would you say is fake?
It's a huge percentage. I don't want to throw numbers that I haven't verified. But a huge percentage of the medication we consume is fake. Right?
And when you say fake, is it that they don't work? Is it that they are not the right brand? Like what about it?
It's because they are fake medication. They're not. It's not whether they are brand names or generics. It's just a fake medication. So
Placebo.
when you use chalk to do Panadol, if you want to take 100 times, well, it won't work because it doesn't have the ingredients to be Panadol, regardless of whether it's a brand name or a generic. A huge chunk of it is fake. Right?
How do these medications actually get to patient? Is it that there's no, like, the regulatory bodies are not screening them? Is it like what is the issue?
Regulation. You see, regulation tries a bit in Nigeria. And the truth is because for regulation to be super effective, regulatory bodies in developed countries are well funded. They are funded with technology, access. So tell me how NAFDAC wants to come to Uburo Hosa. Tell me how NAFDAC wants to come to my village to know that Okoro Pharmacy down my corner is selling fake medication. How? How do they want to know? How? Unless something crazy happens and how do they want to know? Perhaps their zonal office in Ebonyi State, in Abakaliki, does not have functional vehicles. Perhaps the zonal office doesn't have functional vehicles and there's nobody they've been posted there because they don't have staff. How are they supposed to know? How are they supposed to know? How would they track customs? Oh, it's dysfunctional, right? The system is broken in many ways because NAFDAC could be very efficient, but the customs, are they very efficient? Are they stopping the getting of medications coming in? Are they stopping that? Are they, and do we know that? Drug registration. How many medications in Nigeria that people are consuming are registered by NAFDAC? How many of them? How many of them? There's a huge chunk of them that are not registered, right? But an importer knows that, let me go to Turkey. I'll bring this brand. By the time I put it here, we'll buy it. They will come to the pharmacy and they say, and my stomach, there's this new malaria drug now. That's the one that is raining now. Here is it. You got to take. You don't know what it is.
Does NAFDAC have local, like local governments? Because I think NAFDAC is on the national level. Do they have sub-national entities on the local government level?
I don't know if they have at the local government. I think they could have at the states. And it just shows you that a regulatory body like NAFDAC needs to be everywhere regarding health, right? And the truth is, and that's why I said, without corruption, the cost of getting that done is very high. It's expensive. The government that needs to get that done needs to also remember they need to pay salaries, they need to build roads, we again cut out the waste, cut out the corruption, we'll still run at a deficit. We'll still run at a deficit. So from a balancing perspective, it's hard. It's really hard. And I the more I get involved in policy making, I begin to see that our politicians are bad, yes, but the problem is sometimes it's beyond them. It's really beyond them, right? Because when you sit down and think about the work that needs to be done, the structure, right? What you need to fix, how you need to fix it, the people you need to fix, the ecosystem of how medications come into Nigeria, how they register them, what you need to do, all the things you need to plug. It's hard. The airports, do you have good scanners to know if I'm coming with my traveling bag? I've bought 40 boxes of some expensive medication that I feel that it's easier for me to buy from India and come and sell in my shop. Does the scanners dictate that and look, you say, why did you import this? We have a fundamental problem. There are a lot of issues around healthcare that we can spend 1 year talking about it. But let's it's a lot to unpack. Bringing that back a little, I would say that we have challenges around primary healthcare, accessibility and affordability. Those two are very big issues, even in underserved communities, and we need to figure out how to resolve them.
Yeah, no, I mean, I think that's profound. The reason why I asked about NAFDAC and their presence on the local government level is because I know in some parts of the world, when it comes to restaurants, right, they have regular food inspections where they could show up at any time. But this is, I think, on the local government county level where they could show up anytime, inspect, is it sanitary enough? Do they meet these guidelines? And so I was asking that because I'm like, if NAFDAC has, or any other regulatory body has something similar to where they have regular inspections of these pharmaceutical establishments to say, okay, we're going to do surprise inspections once a year or once a month, whatever it is, they might be able to curb some of those, at least get rid of some of those medications that are fake. I'm thinking about the fact that if you take away corruption, we still have a huge problem and there's still a lot to be done. How long do you think it would take? Let's say, obviously, this is in a perfect society because we don't live in a perfect world, but let's say corruption ended. There was no single, corruption ever. How long do you think it would take to get from where we are now to the desired state to bridge that gap?
Okay, I like the fact that you use the desired state and you're not comparing.
Yeah.
Because I would say, how much do you think our national budget is? And compare that with how much universities spend in clinical research in developed countries. We just know that we can't compete. So if it's to ensure that we have doctors and pay them well, basic equipment to provide for primary healthcare, focus on preventive healthcare, NCDs, spread of NCDs, lifestyle, diabetes, hypertension. If we can work on those, we'll get our people much healthier, and we'll begin to, see how we could. Because that's why I say desired could be, we might want to say we want to be like India or the US or the UK. We can't. Today, we can't.
It's not a fair comparison.
Yeah, it's not a fair comparison. But how can we ensure that anybody in every local government can access some basic level of healthcare? That would be a desired place to start. That we can access basic healthcare at convenience. That my uncle Aguize can go to a hospital in my village and see a doctor.
So when you think about that, how would you divide the responsibilities specifically within the healthcare sector between government, well, when I say government, I mean local government, state government, federal government, and then private citizens like you? Like, how would you divide the responsibilities for transforming it into the desired state?
It's a collective responsibilities. Collective responsibility. I can't say you take 20%, you take 30%. It's hard. Government needs to do its part by providing enabling framework, regulation, policy, direction,
Security, yeah.
building infrastructure. We need to do our part in terms of innovation, and all band together, collaboration, stop building in silos, data interoperability. There's so many things that I feel that we all need to put together and start building together, because what that does is that it helps us tackle the challenges around healthcare together. I tell that
Mm-hmm.
to other health tech companies when they ask me, okay, you're always open to partnering with everyone, even your competitors. I said yes, because all of us added together multiply us by two. We're still inadequate, not enough to deal with the issues around healthcare on the continent. We can't fix it. All of us cannot fix it. So why can't we collaborate together? The market is massive. We can't. We are. In fact, more people should come and start doing health tech, because we can't fix all the. There are a lot of issues to be dealt with. Let's more come in and
Mm-hmm.
let's start to handle and tackle these issues together. So it's very collaborative. We all need to, first of all, understand, in my opinion, this basic principle. Healthcare is a fundamental right. Everybody needs access to affordable healthcare. Two,
Yeah.
healthcare and education are the two most important things in life. Healthcare and education, right? We must provide people with
Mm-hmm.
healthcare and education. Three, not healthcare, education, and I will say nutrition, food, right? These three key things are fundamental rights to life. People need to have healthcare, education, and need to feed, right? These are three things, and they're all interconnected. Um,
Mm-hmm.
and the four is that we are all stakeholders. Everybody is an equal stakeholder, right? So we are all stakeholders into the fight, the journey or the quest to ensure that we have access to affordable healthcare. So we are all stakeholders. That would be me listing out what I would consider, the important steps that people need to know as we band together into, confronting issues around healthcare.
What is something you wish more people knew about this entrepreneurship journey that you are on, specifically within healthcare? Maybe something that people didn't really, you think most people don't know, but you wish more people knew.
Healthcare is the most difficult. I've sold a lot of things. I'm a good salesperson by all standards. Healthcare is the most difficult thing to sell. Healthcare is the most difficult thing to sell. I feel that if I was selling wigs, I would sell more. I feel that people are very difficult when it comes to health. I feel that one of the things that needs to support digital health is education. Anybody who wants to build around digital health needs to focus very, very, very heavily on building around healthcare information and education.
Okay. Okay. So that healthcare as a product is difficult to sell. Why? Why do you think that is?
It is because people don't understand healthcare. The way healthcare is communicated to people is very hard and harsh. Two is people are poor, and health care for somebody who is relatively healthy and young and doesn't show any signs is not a lot of priority. I can have a leg pain,
Yeah.
and that leg pain is very painful, but it's not a priority for me to go and get it checked, right? Because if I need to think of paying my rent, think of feeding, I'd rather feed and do all those than go and check my leg. And maybe I have a very big problem with my leg. So that is how healthcare is seen. So it's difficult to sell.
So
And
so
also we
the
have
fact that it's expensive.
and also there's the element of religion, which unfortunately plays a very difficult role in health. In Sub-Saharan Africa, we're very religious people. So,
Mm-hmm.
people will say, ah, no, that's not my portion. God forbid. That's not what God said for me, Out.
Yeah.
So that could also be a challenge.
So when approaching, I like the fact that you brought that up because when approaching people in terms of health education, right, understanding that there are some religious undertones that could make it difficult to reach them. How do you balance it with making them feel like you acknowledge, okay, their religious perspective, but at the same time, this is a real issue that needs to be addressed regarding your health?
I look at it from a couple of angles. The first one is storytelling, the way to communicate. You need to make healthcare communication less, less complicated. And that's why people like Aproko Doctor are,
Yeah.
doing an incredible job of it, because the way they are communicating healthcare, simplifying the communication is very important, and they're getting a lot of conversions, a lot of people, so that whatever is very important.
Okay. Okay. Simplification. Okay. For you, what is something you wish more people knew about you that they don't?
That I'm a very shy person.
Ah, you shy?
I am a very, very, very shy person. Very shy. I wish people knew that.
So, okay, tell me about that. How are you shy, but one, you're able to speak at places like World Health Summit, or you are able to run um, an entertainment business, which requires you, in fact, not even just entertainment, even Zuri Health requires you to constantly be around people or speaking to or with people. Like how? Tell me about that.
I think it's because I perform a lot. A lot
Mm.
of things are performance. So I remember when I started my global MBA, I wrote in my whatever that I'm a very shy person, painfully shy person. People were like, nah, this guy, you're not shy. Because in class, I'm asking questions. But when they go for the social engagements, they don't see me. Where's Ike? He's in his room. He's alone. When people are going for lunch, I'm seated alone at a corner. And I'm like, but this guy was asking.
Mm.
So for me, I've also, because I was confused for a very long time, like, how can I say I am a shy person? How am I? You're very shy. I'm like, no, I'm not shy. But I figured that when it comes to my duties, I can perform. I can, like, this conversation, I can finish having this conversation and like this guy, very engaged, switched on, whatever guy. And the next moment, you see me somewhere and I'm with my bag at one corner, alone. I'm like, you know. So yeah, I wish people know I'm a very, very extremely shy person.
So when you go up to speak on stages like that, do you get nervous?
Yes, I do. And I switch it into my performance mode and I perform.
How do you switch into it? The reason I'm asking all these questions is because I can relate to an extent, not completely, but to an extent.
I switch into it because how do I switch into it? I snap myself into it. I just tell myself, Ike, relax. You know your work. You know how to do your job. You know how to pitch. You know how to engage people. Just go ahead and do it.
Hmm. Okay, okay. How long did it take you to get to that place where? Because I think sometimes, let me try and see if I can differentiate between the two. But I feel like sometimes people are nervous about whether it's speaking, let's say for example, on a stage because one, they don't know fully, like they've not fully, they don't understand fully their work or they don't know their work too well. And other times you may know your work, but you're still um shy but then you have to switch into that performance mode and tell yourself, I know this, I know, Um, for you, how long did it take you to get to the point where you felt like you knew your stuff? Like, and you know that you know your stuff. That if they wake you up from sleep, you
Can
can
I
talk
put it
about it.
this way that I am a very confident person, extremely confident person,
Mm,
but I'm also very shy. I don't know how that works. When it comes to my work, I believe I am
mm,
competent. I believe I can defend what I do, but I am a shy person.
mm,
That when you remove that work, right? When you take work
mm,
out of the equation, I wouldn't know how to function. I would be shy. I would be on my phone. I would look down. I would stay in a corner. That's me. So I
mm.
don't have performance anxieties. I don't.
Okay, that makes sense. That makes sense. So when it comes to the work, no performance anxiety. But
No.
once you take that out,
Once you take the work out,
okay, no, I can relate to an extent. So we've talked about Nigerian healthcare. We've talked about healthcare on the African continent. Where do you see Nigerian healthcare in the next 10 years?
currently going down. There's nothing. In fact, it's not. It's not hopeful with the policies, the government in place. It's not hopeful. With the brain
Uh,
drain, it's not hopeful. It needs it needs a massive change. I don't know. I feel the next 5 years we would really struggle with all the pharma companies leaving, cost of medication, inflation. Things are going to be very difficult and challenging around healthcare. Um, so I don't have a very optimistic 10-year vision around healthcare in Nigeria. Um, I would rather say that I know that a lot of tech companies or health tech companies will grow. Will try and get into the space of solving some of those issues. Um, our prayer is for them to be reasonably successful doing that. Yeah,
mhm.
and that's what if am I having hope that our healthcare system will become better in the next 10 years? No, and that is the reason why we need to. There's a lot of work for us to do because quite on the contrary, there will be regression in healthcare within that period.
What role can Nigerians around the world, Nigerians in the diaspora, play?
Very good question. They should look at what India did. Nigerians should stop building hotels in Nigeria and build hospitals. Send money to equip hospitals. When you the Indian healthcare system were built by Indian doctors, Indian medical professionals who were exposed to the US, exposed to the Western to Europe and came back and said, listen, I want to replicate that in India and see how it's coupled with government
Mm,
policies around intellectual property around medications, and so helped fuel the boom, the Indian boom, healthcare boom. I think it's what we need to figure out. It needs to be a Nigerians in the diaspora needs to think a bit more around investing in healthcare and not necessarily having to be a doctor to do that. So if I had a lot of
yeah.
money, and I said I could find a couple of friends and say, can we invest in building a great hospital focused on research in this area and see what that can do in terms of helping to grow health? That would be my suggestion.
Yeah, but thank you. I mean, I really appreciate it. Oh yeah, come. I want to tell you something. Come and say something. If you got value from that noble conversation, let us know in the comment section below and let us know what you liked. But don't stop there, oh. Don't stop there. Share this video with someone else you think will also get value from this. Don't be selfish. Don't be selfish. Because if you share it with someone else you think will also get value, what that does is it helps us reach more people with the same value that you've received. That's one. Two, it also gives us more visibility to bring on more guests that you would enjoy listening to and getting insights from. And so let's go. Come join us, comment, and share. Let's go.